My name's Atif Malik. I'm a consultant trauma and orthopaedic surgeon with a special interest in the lower limb, in particular hip, knee, and sports injuries. So the reason I became a doctor was when I was growing up. This was when the famine in Ethiopia and Africa was very prominent, and I used to see pictures of all these children in the world and in Africa in particular who were starving to death and needed help and assistance with not enough doctors. So that kind of really developed my interest in medicine. I originally wanted to be a cardiothoracic surgeon, a heart surgeon, and then it was only really when I started working as a junior doctor in particular. My first orthopedic position was working with the surgeon who used to look after Manchester United, and it was really from that I developed my interest in sports injuries. I think the most rewarding part of my job is when people come back after an operation or after treatment and are completely different. Tell me that they're off painkillers, they're able to do the activities that they have always wanted to do. That often is grandparents playing with their grandchildren, parents being able to look after their children, play football with their children, athletes who have returned back to sports. And just seeing the joy in their face and the ability to facilitate that really gives me immense satisfaction. I think what my patients value the most is the fact that I listen to what they want, what their end goals are, and I try and facilitate that by giving the best possible advice. And my advice is not always surgery. In fact, my philosophy is to try and avoid surgery where possible. And surgery, for me, is always a last resort. In particular, one of my interests is in arthritis in the young, in particular of the knee joint, and trying to facilitate every other treatment that we can possibly manage before proceeding to major joint surgery is always my goal.